are a lot of confusing yet very important topics surrounding Medicare. When to enroll into Medicare, when not to enroll into Medicare. What does Medicare cost? What is Medicare coverage? How do I decide upon the best insurance with Medicare? How about getting my prescription drug plans covered? How do I switch plans? And yet at the very top of this list is one that you do not want to miss, and that is, what are the rules surrounding Medicare at 65? In this video, I'll explain. Now, as we talk about this key age of turning 65, I want to address, first of all, those of you who are going to be required to enroll into A and B at 65, meaning you have no other option but to go on Medicare. There's actually 5 groups of people. Number one, anyone who is no longer working, which means what? You or your spouse are no longer working. You do not have a group plan available. You have to start Medicare A and B at 65. Number 2, anybody who is covered by COBRA insurance. Meaning you're no longer working, but that group plan was extended through the COBRA law, and now you're covered by COBRA insurance. And sometimes the previous employer may pay for all of that or some of that, which makes COBRA sometimes very attractive, other times not so attractive. But the point is this: if you're on COBRA and you're turning 65, what happens is you must enroll in A and B because Medicare pays first, and the second payer is going to be COBRA. All right? And so you're required to enroll to put A and B in the first payer position. But if you don't and you just keep COBRA alone, COBRA is not going to change. What's going to happen is you then become the first payer because COBRA is only going to pay second. Once again, you're Medicare eligible. That takes us to the third group of people, and that would be those that are covered by what's called TriCare insurance. TriCare, this is someone that is retired from the military. This isn't VA, that's a whole different program. This is TriCare. So retired from the military, you have TriCare insurance, and what happens at 65 is just like it does in COBRA. You have to enroll into A and B, and then what's going to happen? Your TriCare is going to pay second. But again, if you don't enroll in A and B, now all of a sudden you become the first payer. And again, obligated to go at 65. Number 4, any of you that are covered by what we would call a small group employer plan. Small group. This means you or your spouse are still working, covered by a plan. What happens, Medicare defines a small group as 19 employees on the payroll or less. So that's the key, 19 or less. What happens is this small group plan over here is now going to pay second. And again, you got to enroll into Medicare A and B to put them in the first payer position if you're in a small group. And again, just like these others, if you don't enroll in A and B, that small group still only pays second. And now all of a sudden you become the first payer. All right. And then lastly, some of you are covered by Affordable Care Act plans. You went through the healthcare exchange, maybe through someone who helped you navigate through that process. You have an individual ACA plan or maybe a family ACA plan. So here's what happens. Technically, you can actually keep an ACA plan at 65, but all the incentives, all the things that made that ACA plan look attractive to most people, which would be tax subsidies, reduced premiums, cost sharing that the federal government pays for, once you're 65, all those incentives go away. So yes, you can keep the ACA plan, but no more tax subsidies. You'll pay the full premium. You'll pay the full deductible. There's no cost sharing whatsoever. So there's no reason that you're going to keep an ACA plan once you're 65. So these 5 groups of people have to go on at 65. Now let's talk about the process. Many of you are going to turn 65 and you're not yet taking Social Security. So because you're not on Social Security, you're going to have to self-enroll into Medicare. Self-enroll. You do that by setting up an SSA.gov account, and then you can enroll online, or if you work with us, we'd be happy to do all this for you. But the point is, you got to self-enroll. All right, now, you have a certain time period that you got to be sensitive to, and that time period for self-enrolling at 65 is called your initial enrollment period, and it only lasts 7 months. So let's say someone's date of birth is July 4th, 1959. They would be eligible for Medicare A and B 7/1 of 2024. And their 7-month window is 3 months before they turn 65, the month they turn 65, and 3 months after. And when you self-enroll, when you enroll determines when they start your coverage. So here we have 6, we have 5, we have 4, we have 8, we have 9, we have 10, and we have 11/1. All right, so here's what happens with this 7 months. If I enroll 3 months before I turn 65, my 65th birth month, my coverage starts July, my birth month. Now, by the way, if you're born on the first day of the month, I said this example, they're born on the 4th. So if you're born on the first day, this whole thing shifts forward a whole month. If I'm born on the first day of the month, they actually start my Medicare the previous month, all right? So in this example, born July 4th, 1959, I could start July 1, If I enroll 3 months in advance, I start in July. But if I delay my enrollment, I enroll in July, they'll start me in August. Enroll in August, they'll start me September. September, they'll start me in October. October, they'll start me in November. So the point is, when you enroll determines when your coverage is going to start. So if you're not on Social Security, you're going to have to do this enrollment. And if you have to start at 65, you have 7 months to do it. That brings us then to the second category of people, and that are those who are going to be what? Automatically enrolled into A and B at 65. In other words, they didn't have to self-enroll. Why is that? Well, because they were already receiving Social Security benefits. Now, those Social Security benefits could be their own retirement benefits, it could be spousal benefits, it could be survivor benefits, widow or widower benefits, but any form of Social Security, you're going to be automatically enrolled into Medicare at 65, and the Medicare A and B card is going to be mailed directly to your home. And again, let's look at the time frame. So again, let's use the date of birth 7/4/1959. We know we can start our A and B 7/1 of 2024, and what's going to happen? That card is going to show up right up here. So this is 6/5/4. So right around March the 15th through the 25th, that Medicare card is going to be mailed to you. It's basically about 100 days before your birth month. That card shows up. And again, it's just right before that initial enrollment period happens. So there's nothing you can do. That card is definitely going to show up. Now the question is, do you have to keep the card? Do you have to stay enrolled in Medicare A and B? And the answer to that is yes, if you're in those 1 of 5 categories that I talked about. Yes, you're going to keep the card if you're no longer working. Yes, you're going to keep the card if you're on COBRA insurance, TriCare insurance, on an ACA plan, or on a plan where there's 19 employees or less at that company. You're going to keep the card. But if you're covered by a group plan that has 20 employees, again, on the payroll or more, what can happen is you don't have to take your Medicare B. Meaning, if you have a good group plan that's available to you, you like the plan, the cost, the coverage, you can stay on that plan. And then what you do is you can send your card back in, and there's a way to do that. There's a form called 1763, or the easiest way is when the card comes, just turn it over. They give you the chance to opt out of Medicare B. You check a box, you sign your name, you send it back in. When they get the card, they will drop off the B, and then they will send you back an A-only card with the 7/1/2024 date on it. And then you can pick up B at a later date when you lose that group plan that was considered to be a large group plan. Otherwise, you're automatically enrolled. If you're not in a group, 20 or more, you're going to keep the card. Now that takes us to another group of people at 65, and that's those who are not required. Why are they not required? Because they or their spouse still working, covered by a group plan that has 20 employees or more on that payroll, and they're covered by that plan. They are not required to do anything with Medicare. They don't have to do A, and they don't have to do B, but notice what I put in here, they should. Well, why is that? Well, because that group plan that they're on is not as attractive as an offer as what Medicare would give to them. And so what we encourage people to do in this scenario on a group plan, what you want to do is compare your Medicare options. Compare what A and B plus other insurance would be and what that coverage would look like. Do a comparison. You work with us, we're happy to do this. But I would want to know, what's my group premium? What's my deductible? What's my co-insurance? What's the max out of pocket if I got cancer? If I have to spend $10,000? In other words, what is it costing you to be on that plan? My rule of thumb is basically this. If that group plan is costing you $250 a month or more, or let's say it's costing you $253 or more, and you have a deductible of maybe $1,500, $2,000 or more, max out of pocket of maybe $7,000 to $10,000 or more, meaning not very attractive plan, then almost always your A and B option is going to be a better option. So just take the time to compare these two options. So do you have to go on Medicare? The answer is no, you don't. But you may want to do that if indeed Medicare makes more financial sense. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. The next group I'm going to look at 65 are those that are not required. Why is that? I've taught you this. 20 employees on the plan or more. It's a group plan of you or your spouses. Don't have to do anything with A and B. But notice what I say here. You're not required to, and you should not, meaning you better not, because Medicare is not your best option. Why is that? Well, you did a comparison. and you found that your group plan is a good plan. You like the cost, you like the coverage. It has a good network. It has a low premium out of your pocket. It has a very reasonable deductible, max out of pocket. All those things are very favorable, and so you've made that comparison, and it makes more sense to be on the plan. Stay on the plan. No problem whatsoever. You can come into Medicare at a later date, really any age you want to, and you're going to come in using what's called the special enrollment period. It's called an SEP. And the main thing to remember about an SEP, let's say you stay on the group plan till you're 67 years old. And what we have to do is we just have to verify that you have had credible insurance, you or your spouse, at work back to age 65 with no gaps in insurance at all. That's the only thing we have to do, verify that. And we verify that with a form that your HR department fills out called an L564. And that brings you into Medicare, no penalties or no problem. That's called the special enrollment period, okay? And so you don't have to take A or B at 65. Why you're eligible as long as you've had that credible coverage with no gaps. So if you happen to change jobs after 65, you want to be sure there's no insurance gaps or go on Medicare even for a short period of time. That's the SEP, all right? Now, and another reason some people should not is this. If you have a spouse that's on your group plan, or you have children that are covered to age 26 on your group plan. Whether it's good or not, if they don't have any other insurance options, then you absolutely should not go on Medicare because you dropped the group plan. They'll lose their insurance as well. So we wouldn't want anyone going on Medicare if somebody else in the family is going to be adversely affected by that decision. All right, that brings us to another group of people. Again, we're talking about those turning 65. Those who should not enroll into A only. Those they shouldn't even take A only. Now, there are a lot of people who know that they do not have to take Medicare because they're in a large group, but they will hear that, oh, even if you don't take A and B, you still have to take A only. And folks, that's not true, and you will not be penalized. Here's why. Because for 99% of the population, Medicare Part A is going to have a zero premium. Right? Now, 1% of the population has to buy A, but if you have zero premium on your A, there will never, ever be a penalty. Never a penalty on Part A. If it's free and zero, it's always going to be zero. The only people that actually have to pay an A penalty are those that have to buy Medicare A. They don't have 40 quarters, and therefore, if they don't start it on time, then there will be a percentage added to their Part A premium. Again, it's only 1% of the population that has that. So if you or your spouse have 40 quarters, you get Medicare A for free. You're not required to enroll into A only. And here I'm saying you should not enroll to A only at 65 if you have a group plan and you are contributing to an HSA. That's a health savings account. That does not apply to flexible spending. It does not apply to health reimbursement arrangements. Only HSAs, part of the IRS tax code that says you can put money into an HSA. That money goes in tax deductible. If it's in a growth account, it grows tax deferred. And if you use that money for medical expenses anytime in your life, it's going to be tax exempt for the rest of your life. And so HSAs are wonderful. They really are, like a healthcare IRA. And so here's what happens, though. I'm saying to you, don't enroll into A only, because if you do A only, you can no longer put money into your HSA. The money in your HSA is your money, but you can no longer put new money into that. You can no longer fund it, nor can your employer. So HSAs are wonderful. Now, in 2024, you can actually put in $4,150 for the year on an individual plan, $8,300 for a family plan. Plus, you can do what's called a catch-up. You can put an extra $1,000 if you're above the age of 55. And so again, I think it'd be much wiser if you have an HSA plan at your work and you can contribute to that, or your employers contribute to that, to go ahead and do not take A only. Okay? Now, if you did take A only, Medicare is only going to pay in the second position anyway. So I think it's much more favorable to continue to be putting money in the HSA, build that account up, because you will not be penalized if you don't take A at 65. All right, then that brings us to those of you that are turning 65 and you are on a large group plan, 20 or more, and you don't have an HSA, never had an HSA, it's just not an option at that employer, then it is fine for you to enroll into A only. Now, you don't have to, because there's not going to be penalties if Medicare A is going to be zero premium anyways, but it's all right to do so. But just remember this, your company plan is still going to pay first, and then your Medicare A only is going to be put in the second payer position. Medicare in the second payer position will not pay any deductibles for you, will not pay any co-pays for you, but it will pay co-insurance. And so there could be a time in which you're hospitalized and you have some co-insurance from your group plan. Medicare may pick up some of those co-insurance balances of the bill. So I encourage people, as long as you don't have an HSA that you're contributing to, go ahead and enroll into A only at 65. You go to the hospital, you give them your group plan card, it's going to pay first, and then you give them your Medicare A only card, and Medicare may pay something in the second position. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, that brings us into our very last slide, and frankly, really the most important probably of everything I've shared with you. I think it's all been important, but this is critical. And this is statement here. No one should miss this notice. Once in a lifetime opportunity, but watch this. This opportunity can happen at 65, or it could happen beyond. You could be 66 or 67 or whatever. But the point is, this is still going to be a once in a lifetime opportunity. And this opportunity has to do with what we call a Medigap. The Medigaps are also called Medicare supplemental plans. Open enrollment. Okay? And again, everyone has a once-in-a-life opportunity to take advantage of this Medigap open enrollment period. As you read about this, sometimes people also call this guaranteed issue. Okay? Guaranteed issue. So let me explain what this means. This once-in-a-lifetime opportunity is actually tied to your B date. So let's go back and let's give you a quick example. Let's go back to my example of someone born 7/4/1959. Now, let's say they are going to start Medicare A and B at 65 because they have to. And so they're going to have a Medicare A date of 7/1/2024. They're going to have a B date of 7/1/2024. Now, watch this. This once-in-a-lifetime opportunity is actually tied to the B date. Now, because they started at 65, then their A and B dates are the same. But the key is the B date, because this Medigap open enrollment period, where I don't have to go through any underwriting, I actually can get any Medicare supplemental plan that I want. I can actually apply anywhere from 3 to 6 months before my B date. And then this period also goes on for an additional 6 months after my B date. So again, I can apply before so that my MedSup plan, my Medigap policy, goes into effect 7/1/2024, along with my A and B dates. But then I still have this 6-month window that is still open. So if I change my mind, I can during this 6 months. And during this period of time, I have no underwriting whatsoever that will be required. No underwriting. Which means what? If I want to do a supplemental plan with United Healthcare, with Aetna, with Mutual of Omaha, with Cigna, with whoever, it doesn't matter. Any of those companies, wherever you live, if those policies are offered in your state, they cannot subject you to any kind of underwriting. They cannot ask you any health questions. Any pre-existing conditions that you have during this window of time, they have to cover those. You don't have to tell them about any medications you're taking. No health questions asked. So this is a wonderful period of time for people to get MedSup plans with no underwriting whatsoever. Again, we can apply 3 to 6 months in advance of our B date, but officially then this 6-month window will last for 6 more months. So in this example, that would be all of July, August, September, October, November, December, which means what? From 1/1/2025 onwards. Now that this Medigap open enrollment period is now over, I lost my once-in-a-lifetime opportunity. If I want to get a MedSup plan from that point forward, or want to change from that point forward, now I have to go through medical underwriting, okay? I'm going to have to answer 25 or 30 health questions. We're going to look at all your medications. And if there's something in your medical records or in the way you answer your health questions or your medications that insurance company is not comfortable with, they absolutely say no, we're going to not deny that. You've lost your guaranteed issue right, and then you can only get an Advantage plan, frankly. Okay, so now you can't get that Medicare supplemental plan after that 6-month window is open. So that's what we're saying. You don't want to miss that opportunity. Now, I also want to explain this. We put in here beyond. What if you don't take Medicare at 65? How does this rule work? Let me explain. So again, let's go back. And let's say this person here is, their birthday was still July 4th, 1959. And let's say they decide to enroll into A only. That's all they do. They're not contributing to an HSA, so they're fine to enroll into A only. And so they started that on their 65th birth month. So their A would be 7/1/2024. But let's say they decide they're going to work 2 more years. And they're going to work until, let's just say they're going to work until July of 2026. Their coverage is going to end at work, and so they really want to start their Medicare August 1 of 2026, 2 years later. And so remember what I told you earlier, they got to go through that special enrollment process. They got to verify they've had credible coverage all the way back to 65. The employer verifies that. And so we enroll into B, Medicare Part B using special enrollment period. Remember, that's that L564 form I told you about. We also have a 40B form we fill out, selecting the month we want to start. So we put on that form, I want to start my B 8/1/2024. So I've got A and I've got B. Now, this open enrollment period is now tied to my B date. So I didn't lose my opportunity at 65. It still continues on for me. Then once I retire, got off the group plan, now I can set that up. Again, I can apply 3 to 6 months in advance, but the 6-month window now would be, this should be 2026. This would be August, September, October, November, December, January. So then February of 2027 on, if I want to get a Med Sup plan. Now I have to qualify. But as long as I'm doing it within 6 months of my B date, either 3 to 6 before or 6 months after, there will still be no underwriting whatsoever, no health questions asked, no medication checks whatsoever. Now, all that I taught you is true, folks, in 46 states and the District of Columbia. Okay? But there are 4 states that do not have this requirement, where in fact in those states there's never underwriting. That would be New York, Connecticut, Maine, and Massachusetts. You can actually get a Medigap policy anytime that you want, with certain rules, of course. But the point is, all the rest of the states, you're going to have to live by this 6-month rule to be able to get that Med Sup plan. And I just don't want you to miss that once-in-a-lifetime opportunity, especially those of you that may have some health problems, and because this could be your once and only opportunity to get a wonderful Medigap policy.